Hey there, future doctors. Whether you're prepping for exams or just curious about kidney diseases, you're in the right place. Let's break down glomerulonephritis in under 90 seconds. Fast, simple, and to the point. But don't worry, we'll make every second count so you walk away with a crystal clear understanding. Glomerulonephritis is just a fancy term for inflammation of the glomeruli, the tiny filtering units inside your kidneys. These glomeruli are like microscopic sieves, working tirelessly to keep your blood clean and your body in balance. These little guys act like your body's coffee filters, cleaning waste out of your blood. Imagine pouring coffee through a filter. Only the good stuff passes through, while the unwanted bits get left behind. That's exactly what your glomeruli do for your bloodstream. When they get inflamed, the whole kidney system can go haywire. Waste products and fluids can build up, and your body's delicate balance gets thrown off, leading to a cascade of health issues. Now, glomerulonephritis can hit you quickly, that's acute, or sneak up slowly over months or years, which is chronic. Acute cases might follow an infection, while chronic cases can simmer quietly, sometimes going unnoticed until significant damage has occurred. Either way, it messes with how your kidneys filter blood, setting the stage for kidney dysfunction. This means your body can't get rid of toxins and excess fluid as efficiently, which can affect nearly every organ system. But what actually causes this inflammation? Let's dig a little deeper into the root causes. Sometimes it's a reaction to an infection, like a streptococcal throat infection. Think post-strep glomerulonephritis. After your body fights off the infection, the immune response can accidentally target your kidneys. Other times, it's your own immune system getting confused, like in lupus or IgA nephropathy, and attacking the kidneys by mistake. Autoimmune diseases can trigger chronic inflammation, leading to long-term kidney damage if not managed properly. So, how do you spot it? Recognizing the symptoms early can make a huge difference in outcomes. The classic signs are hard to miss. Cola-colored urine, which means blood is leaking into the urine. This is called hematuria. This dark, tea-like color is a red flag that something's wrong with your kidney filters. You might also see foamy urine or proteinuria. Yep, that's protein sneaking through those damaged filters. Protein in the urine can make it look bubbly or frothy, and it's a sign your kidneys aren't doing their job. Swelling, especially around the eyes and ankles, shows up as edema. This happens because your body is holding on to extra fluid that your kidneys can't get rid of. And don't forget high blood pressure, which often tags along. When your kidneys are struggling, your blood pressure can rise, putting even more strain on your heart and blood vessels. Let's get a bit nerdy for a second. Pathologically, what's really happening is immune complexes. Think of them as clumps of antibodies, deposit in the glomeruli. These immune complexes trigger inflammation and attract more immune cells, making the problem worse. This kicks off inflammation, damaging the filter and letting protein and blood leak into the urine. Over time, this can scar the glomeruli, reducing their ability to filter your blood. That's why you see those telltale symptoms. The earlier you catch these signs, the better your chances of protecting your kidneys. Treating glomerulonephritis means tackling the cause. The treatment plan depends on what's triggering the inflammation, so getting the right diagnosis is key. If it's a bacterial infection, antibiotics are your friend. Clearing the infection can stop the immune response and prevent further kidney damage. For autoimmune types, steroids or immunosuppressants help calm the immune system down. These medications reduce inflammation and help protect your kidneys from ongoing attack. And catch it early, because the longer it sticks around, the more likely you'll end up with chronic kidney disease. Chronic kidney disease can lead to long-term complications, including the need for dialysis or even a kidney transplant. Alright, that's glomerulonephritis, explained in a nutshell. Remember, understanding the basics can help you recognize the warning signs and make a real difference for your future patients. If you found this helpful, make sure to hit that subscribe button for more clear and concise breakdowns of tough medical topics. We're here to make complex concepts simple and memorable. Keep studying, stay curious, and I'll see you in the next video.